A clinic visit ends with another prescription, yet the drivers of disease through diet remain unaddressed. Preventable illness becomes normalised when daily meals are treated as background rather than a source of exposure. Most early deaths are linked to modifiable choices, with diet often at the centre of these factors. When the inputs remain unchanged, drugs can manage symptoms while the underlying process continues. The result is fewer healthy years and more time spent managing symptoms that could be avoided. 15 major killers share overlapping risk factors, so one framework can influence many outcomes. Medical training devotes little time to nutrition, leaving food guidance often superficial. This gap often leads plans toward procedures when targeted dietary changes could lower risk. Next, you will learn a prevention mindset, a dietary pattern, and a simple daily checklist. This video is inspired by How Not to Die by Michael Grieger and Gene Stone, and subscribe for practical food choices that lower risk. Lifestyle medicine involves using daily choices, especially food, as primary tools for preventing and treating chronic diseases. The mechanism is simple, as repeated exposures can shape inflammation, cholesterol levels, blood pressure, and metabolic control. This approach can influence multiple leading killers, as many share the same upstream drivers. It shifts the goal from reacting to disease after damage has occurred to reducing damage before it accumulates. A cardiology team warned that dietary improvements can lower blood pressure and diabetes quickly, necessitating medication adjustments. That warning shows how food changes can move clinical numbers fast, not just over years or decades. This supports focusing on root causes, as procedures can relieve symptoms while upstream factors continue to operate. It also respects urgency, as prevention starts earlier than most people expect, even when disease is already developing. Begin by listing the most frequent meals each week. Then choose one change that increases the intake of intact plant foods. Track that change daily, as consistency is more important than rare, perfect days when building a prevention habit. A whole food plant-based diet emphasizes unrefined plant foods and minimizes meats, dairy, eggs, and processed items. The mechanism works through displacement, as protective foods rise in prominence, while harmful foods and additives take a lesser role. A simple diet quality score can be based on the percentage of calories coming from unprocessed plant foods. Scores remain low when most calories come from processed plant foods and animal foods rather than intact plants. A survey of death row last meals showed the same pattern, with few whole grains, vegetables, or legumes being chosen. This contrast suggests that default food environments push choices toward processed options unless deliberate changes are made. This pattern connects back to prevention because chronic disease risk tracks long-term dietary quality, not single meals. It also explains why a vegetarian label can be misleading when refined carbohydrates and packaged foods dominate the menu. Choose one meal each day to rebuild around beans, vegetables, fruit, and whole grains in recognizable forms. Keep the rule simple, as clearer defaults reduce decision fatigue and make adherence more realistic. Primordial prevention involves stopping risk factors before they arise, rather than waiting to treat diseases later. The strategy is to stack daily behaviours that keep cholesterol, blood pressure, weight, and glucose within healthier ranges. 4 key factors: diet, activity, smoking status, and body weight account for most risk in major chronic diseases. Studies suggest near elimination of diabetes and significant reductions in heart disease, stroke, and cancer. The challenge lies in adoption, as one report found only one person met all 7 heart health metrics. Another report indicated that only about 1% achieved an ideal, healthy eating score. This highlights that the target is not complexity, but reliable routines that fit ordinary days and budgets. It also reframes motivation, as small wins in multiple behaviours add up faster than one heroic change. Start by picking one food change and one activity change that can be repeated daily, then build from there. If this prevention approach feels useful, subscribe for more evidence-based habits that make healthy defaults easier. Heart disease is framed as largely preventable because the main driver, cholesterol, is strongly influenced by diet. The mechanism involves plaque formation in arteries, which begins early and progresses when cholesterol remains elevated. Autopsy reports describe fatty streaks in most people in their 20s, showing the process starts long before symptoms appear. Populations with total cholesterol under about 150 milligrams per deciliter, are described as essentially free of heart disease. Reversal is possible, including programs that improved coronary disease without drugs or surgery. This possibility changes the mindset, as the target becomes removing the cause rather than merely managing pain. Supplements are not a shortcut, and fish oil was described as showing no protective benefit for key heart outcomes. This ties back to diet quality, because whole plant foods can displace the sources that raise cholesterol most. A practical next move is to center meals on beans, whole grains, vegetables and fruit while reducing animal foods. Work with clinicians when changes are made, as medications may need adjustment as blood pressure and glucose levels shift. A daily checklist can transform broad nutrition advice into concrete, repeatable goals. The Daily Dozen offers such a checklist, organizing key food groups into daily serving goals. These targets include multiple servings of beans, greens and fruit, plus whole grains, nuts, seeds and spices. By specifying quantities, the system reduces ambiguity and makes progress measurable without complicated tracking. One practical method is to keep the checklist on a refrigerator and use a dry erase marker each day. This simple routine can build consistency, making the habit visible for everyone in the household. Food quality is linked to aging biology, with diet quality described as improving telomerase activity. Telomeres were even reported to grow after months of comprehensive lifestyle change, including a plant-based diet. Start by printing a checklist and aiming for partial completion, then add one additional target each week. Focus on food quality rather than restriction, because better inputs can accumulate benefits over years. The central shift is treating food as a daily driver of risk, not a side topic saved for later. When prevention comes first, the focus moves from managing disease to reducing the exposures that create it. You learned why nutrition-based habits can influence many leading killers, and why genetics explains only a small share. You also saw how primordial prevention and a whole food, plant-based pattern create better numbers before crises appear. Heart disease examples show that change can matter even after plaque forms, and supplements do not replace dietary quality. A simple checklist makes the system actionable, and lifestyle changes were linked to telomerase activity and telomere growth. Choose one meal today to rebuild around intact plant foods, and keep the change small enough to repeat daily. Add movement and avoid smoking, because combined habits shape outcomes more than any single perfect decision. Over weeks, the same choices become defaults, and the work shifts from willpower to routine design. For more evidence-based food guidance and daily tracking ideas, subscribe to keep building routines that protect long-term health.